Hi there, good morning. My name's Jenny Gallagher. I'm one of the community children's nurses. We are here to have a look at Murray's gastrostomy and maybe do a button change as well.
Good.
What reason did they start to think about putting a button into him?
He wasn't taking his medicine for his epilepsy, and he was quite underweight as well.
We're obviously doing this at school today, but at home we would expect you to be able to look after his tube and administer his feeds and water, medications at home as well. The changing of the water in the balloon is something that is normally parents would take that on, but the changing of the actual device in his tummy is not something we would normally expect you to take on until there's a time point where you felt comfortable to do so, and full training would be given to support that. Okay. Normally when we're looking at his gastrostomy and everything, because I'm from a nursing background, I will put gloves on, but as a parent you wouldn't be expected to wear gloves. Is that something that you...
Yes,
yeah,
just wash my hands.
Just careful hand washing, and that's something that's all been shown to you in the past?
Yes.
Yeah, that's fine. Okay Murray, so we're just going to clean your button, okay? So we have a wee look at it. Is that alright? I'll just tuck your jumper up. So he has a gastrostomy button, which is what we would call a low profile device, and it doesn't have a long tube on it, it's just flush with his skin like that, and it should turn nicely all the way around, which is good. So just looking at that just now, I can see he has a little bit of redness around underneath the button, which is quite normal. At home, once this is established, so after a few weeks of it being inserted surgically, this is just normal cleaning, so soapy water in the bath. A soft cloth that doesn't shed any fibres is what you want to use for that. Okay.
Would a muslin be okay to clean that?
A muslin, soft muslin would be fine, yeah, and you can obviously then wash that in the washing machine and reuse it. I'm just going to give it a wee clean with some water that I brought. Okay. Importantly, once his button site has been cleaned, the important thing is to make sure that it's really dry as well, rather than leave it as a wet area, to make sure you're giving it a nice dry as well. Okay. There's two ways we can give him feed it through his button, and that is by bolus gravity feeding or by continuous pump feeding. Some children don't tolerate feeds given in a shorter period of time through the bolus, and that's why it needs to be given over a longer period of time through the pump. The decision about which type of feeding that a child has will depend on that individual child. So we're going to give him a bolus of water, okay? So first of all, this at the moment has air in it, okay? So we want to fill it up with water. So the clamp's shut, but I'm just going to attach the syringe. I'm just going to open the clamp, and I'm just going to push the water through until it comes to the end of the extension set, okay? And clamp that off. We're going to attach the extension set, and it's about matching up the two lines on your extension set with your button. You just pop that in until it's down flush, and then turn it round almost a full turn, and that's us ready to use his button. Clamp is closed at the moment while we pour in our first lot of water. When I unclamp this, the water's going to start to run in. If I have it high up, it will go really fast, and if I have it low down, it will go really slow. Because it's water, which is very thin, it will go fast anyway. It's hard to make it go particularly slow. So we're just going to open the clamp and let that water come down. And of course, because he's getting a water bolus, we just need to check that as this goes into his tummy, that he's comfortable, he's not gagging, he's not looking like he's retching, he's not looking like he's in any pain, and that he's quite comfortable during this. If at any time he did start to retch or look uncomfortable, we would clamp the bolus from going in, okay, and give him a little rest. Consider the fact that this is his, if he's having a bolus feed, this is his lunch, this is his supper. How quickly would you expect a child of his age to eat their supper, their lunch? And so we don't just fire it in. And normally, depending on the amounts, we would expect it to at least take 20 minutes. Okay. So Murray, I think we're going to change the water in this balloon, okay? So this is something that is done every week. On the button here, we have the feeding port on the top, and we have the balloon port on the side. And this one actually says BAL for balloon, okay? This particular mate of gastrostomy button is a 5 ml balloon normally. Is that what you put in?
Yes.
Yeah, okay. So we first of all have to take the old water out the button. Because there's pressure in the tummy, you'll often find that the water will start to come back itself. but to need all the water to come out, you just pull back on the syringe gently. And what you should find is that you get 5 mils back out the balloon, Murray.
What happens if you don't get 5 mils back out?
If you don't get 5 mils back out, we don't panic, because it might be that on the best of intentions you didn't actually put 5 mils in the week before, but we need to keep an eye on that balloon, because it could mean the balloon is leaking slightly, will mean that the tube could fall out, okay? So I would advise that you then put 5 mils into the balloon, and then you check it maybe earlier than the week to see if there's getting 5 mils back next time. Okay? Once you've taken that water out, there's nothing holding the button in, because the balloon is deflated. So we usually advise to keep our hands on the button while we're taking that water out, okay? So that's our 5 mils, okay? And then it's just a matter of, again, pushing the syringe in and gently pushing the water in. Okay. So you keep the plunger in as you just take that syringe off. And that, my young man, is your water change all done. So have you ever had a time when his button has fallen out by itself?
No.
No, okay. Sometimes this does happen, and that means that the hole could potentially start to close. Okay. So it's very important that something's done about that within about 2 hours' time.
2 hours, okay.
Now, what is done about that, it depends on what level of training you've had and what support you have in the community. So it's a good idea for Murray to bring his spare button to school.
Yeah.
So we're going to put in a new button today. So this is a feeding port here, and the balloon is down here, and this bit here is the length. So we're just going to check that the balloon is not damaged before we put it actually in. So we're just going to pop 5 mils of water in the balloon, and you should see there that it's nice and even and there's no leakage.
Brilliant.
Okay, so for changing his button, the first thing I'm going to do is take the water out of his balloon.
Well done.
And then it's just going to be a matter of lifting this one out, okay?
Okay.
Okay. Now that brown colour on the side of his button is absolutely fine. That's just the material of the button, the balloon reacting with the acids in the tummy.
Okay.
So you want to avoid touching the stem of the button, okay? And nice firm grip on the skin, and it should just slide in.
Well done, Murray.
And in goes the water. So our balloon's in place, our button's in place. We just want to make sure it doesn't feel that it's sticking or anything, and it looks nice and secure. We're just going to take a wee aspirate to check the position, okay? Now this is something we only do when we've put a new tube in. We don't need to do this to use the tube every time or anything like that. Okay.
Okay.
And check that our clamp's open, and then we just want to aspirate a little bit of the tummy out. So we've got the gastric aspirate in the tube, and we're just going to push that out onto the pH paper. So we can see that the pH there is sitting at 2, and it should be 5.5 or below to make sure that it has got the right acidic level to confirm that it's in the tummy. If the pH had been over 5.5, we would need to speak to our healthcare professional about what to do in those circumstances. To complete this procedure, we have pulled some tummy contents through the tube. There's a risk now that the tube could be blocked if we just leave those tummy contents sitting. Okay. So what we have to do is a little bit of a flush of water down his tube to make sure that that is not going to block the tube. So we're just going to go ahead and give a small flush just so that the tube doesn't block. Okay. Right, mister. You've got a new button. So that's us all done for today. Have you got any questions at all?
No, I'm good, thank you. Thanks for showing me.
Thank you for coming, and thank you for being such a willing volunteer, Murray.